Scrambling to catch up with the Ebola outbreak, the World Health Organization may declare a health emergency. Now, this comes as a case may now be in Saudi Arabia. Worldwide, there are more than 1,700 cases of Ebola, and that includes the 2 Americans being treated in Atlanta. If the WHO enacts that emergency, it would lead to travel bans in and out of West African countries. You know, the Ebola outbreak has plenty watching closely, including here in central Oklahoma. Our area hospitals are preparing just in case Ebola does find its way here. KOCO's Brian Schlonsky now with more of the preps to keep you safe.
Doctors say it's very unlikely anyone with Ebola would be brought here to Oklahoma, but if they were, specialists say they'd be ready, and most likely that patient would be brought right through these doors. The Ebola outbreak in West Africa is the worst in history. The CDC reports more than 1,600 people have been infected, with close to 900 deaths. It hasn't hit the U.S. yet, and doctors here hope to keep it that way.
With a 56% mortality rate, what we're saying there is if you and I both have this virus, one of us probably will not make it.
James DeHaven is the disaster specialist at Integris.
And this gives you good protection of your eyes, so in case there's a splash of some type of body fluid, and then also to protect your mouth. Any type of entry point in your body should be covered.
DeHaven says the outbreak in Africa has the hospital reworking some of its disaster plans.
And give us additional training as far as what blood samples will need to be taken and other bodily fluids.
If an Ebola patient did come here, they'd first be taken to a special room. We're standing outside one of the hospital's isolation rooms where the airflow is actually controlled to make sure nothing infectious gets out. Then the hospital would limit which doctors go in and out.
One person would do the blood draw, one person would do respiratory, only one physician would go in.
That physician,
when there's an outbreak worldwide of any sort of disease, we go back and relook at all of our policies and procedures.
Would be Dr. David Chancellor, an expert in controlling infectious diseases.
But there are lots of different things in place that we do every single day with other patients that have infections that can be tweaked a little bit to conform to a specific disease process.
The doctors say they've been asking the travel histories of some of their patients. That way they know if anyone with Ebola symptoms has been traveling near the outbreak. Reporting in Southwest Oklahoma City, Brian Schlonsky, KOCO 5 News.